So, doctor, I mean, you're obviously so busy with the amount of patients and everything that you do. How do you maintain your lifestyle? How do you maintain, your emotional wellness? But before I get there, I wanted to ask you, how do you see an impact of emotional wellness and chronic stress, sleep deprivation on the immune systems of your patients and cancers and gut issues? I would love to hear you.
So yes, I think the emotional aspects are a very undertreated or under-investigated part of patients, and I think all of us also to blame. I mean, I would, we don't really delve into the emotional well-being of the patient when we discuss cancers. Of course, when they come to us with a diagnosis of cancer, they're usually broken, they are anxious, they are scared, they are, there are a variety of emotions. But, what we've always noticed is that, everyone has a different reaction when they're diagnosed with cancers. And we've always found that patients who are very positive, patients who have their chin up and say, okay, let me see, let's face it. And they sail through the treatment. They really do. And time and again, we've seen that. I mean, it's never coincidence. I mean, we used to think that, how would that change things? But that's something that's not really studied, that's not documented, or, but there's a very clear correlation that we see between a patient who's cheerful, who's positive, who says that, let's get through with this, vis-a-vis a patient who is, depressed, who's broken, who says, I might as well die. People have convinced them to somehow come and get treated. And we've noticed that all the ones that are very anxious, who keep doubting what is going on, who can't trust anybody else, who don't, and we've always found that those patients always struggle in the course of their treatment. And the same treatment is given to A, B, and C.
Different outcomes.
But you see different outcomes. And probably it's got a lot to do with their emotional well-being. So I think it's got a huge role
we see that too, doctor. I mean, drastic difference from the time they're diagnosed, their attitude, through their chemos, through post-surgery. Their attitude just makes this insane difference in their outcome and even in their side effects. Like literally sometimes, so we work very closely with Tata Memorial, and a lot of our patients go there for chemotherapy and radiation. And they're like, the ones who are happy, who have just come in smiling, some of their side effects they don't even get certain side effects compared to the other group that's getting the same kind of chemotherapy. No, thank you for sharing that, because that gives a lot of hope to people as well. Everything may not be documented, but we definitely get to choose our attitude or try to kind of, work towards that attitude. Yeah. So back to you. Tell us about your lifestyle, how you manage your time, your emotional wellness, your health, being so busy.
As far as emotional well-being is concerned, yes, I think for doctors that's a challenge, because we are faced with very stressful situations throughout the day. But we over time we do develop coping strategies. We do try and not pin down everything that happens to what we are doing. To understand that sometimes nature can have other plans in spite of the best efforts that you do. And I think that's important for every medical, whether it's a doctor or a nurse or anyone who's in the healthcare space should understand that. Of course, we try our very, very best for every patient. And but sometimes, things do get stressful when things don't go as planned. But I think balanced mind is very important, and I think that's something that all of us have to work on. Apart from that, I think to maintain health, I think I'm not a fitness freak, but I try to gym thrice a week.
That's good.
Have my cardios, and I need to keep my muscle tone good. The long hours of surgery, I need to take care of my back. So I try and do a few things. I try to, something that I was not doing earlier was having my food regularly. It was a very irregular pattern. and that I've changed over the last few years. Even if it means taking a 10-minute break between a long surgery, I make it a point to come out, have a bite, get my, carbs, because, surgery is stressful and it tends to get your sugar levels, down.
Yeah.
So, I need, the complete focus has to be there. So have a light meal and then go back to surgery.
Amazing.
Otherwise, nothing really much. Okay. But I do try and maintain a fairly healthy lifestyle.